Hello, we are SPU students working with REST to bring you Trust Before Treatment, a presentation exploring ways to provide trauma informed care for sex trade survivors. We encourage you to take the survey by scanning the QR code on screen to assess your understanding of trauma informed care prior to engaging in the following content. This survivor had an outstanding experience with an anesthesiologist, allowing her to feel safe within the healthcare setting. Nurses are responsible for providing safe, inclusive, and medically competent care. Safe environments allow for the survivor to disclose experiences that can help provide competent care and report cases to authorities. When survivors seek out healthcare, they are in a state in which the nurse's approach should be intentional yet authentic. Using approved vocabulary and narrating interventions can allow for the patient to have a positive experience. Survivors may present to healthcare settings accompanied by their trafficker. It's imperative to know how to distribute resources or implement treatment when the survivor is accompanied. Trauma informed care is an approach to care that recognizes the impact of trauma on an individual's health and well being and aims to support their recovery. The goals of this approach include safety, trust, and reducing the risk of re traumatization. Trauma informed care allows staff to change their approaches and methods of care delivery to promote safety and autonomy. The six core principles include safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, cultural, historical, and gender issues. Through our research, we found a study focused on 60 female sex workers with the goal of reducing client and partner violence rates. Intervention approaches include trauma informed harm reduction and safety promotion, as well as information and normalization of violence support services. The results of this study show that up to 98% of participants feel comfortable and safe speaking with the nurses and/or healthcare providers. This would assist with establishing rapport and connecting resources to support their path out of the sex trade. To provide trauma informed care, it's important to show respect, collaborate efficiently with other professionals to optimize outcomes, and ensure that there is a continuation of care. Nurses need to be able to accommodate for how trauma affects individuals differently, and to ensure that empowerment and transparency are held to the highest regard. To allow for consistent healthcare, needs such as substance abuse treatment, housing, food, and job training should be addressed. Additionally, it's imperative to be clear and logical, but authentic when working with this population. Characteristics of the nurse that have fostered a positive experience include being warm, empathetic, and personal. It's important to monitor their well being, understand the impact of trauma, and anticipate the needs of the patient to help them feel understood. The team should ensure that the care is individualized so that the patient feels like care is designed personally for them. Providing genuine care requires the absence of judgment and bias towards the patients and their behaviors. Perceived judgment can deter survivors from seeking future care and worsen their feelings of hopelessness. Compassionate, non judgmental care allows providers to recognize their own biases and foster a supportive environment. As a nurse, you must provide genuine care. It's important to approach patient care and interactions without judgment or bias. If a survivor feels they are being judged in any way, it can have profound negative effects. They are more likely to be distrusting of nurses, which results in hesitation of disclosing their experiences and avoidance of seeking care. This avoidance can worsen health outcomes and reinforce feelings of hopelessness. Another important aspect of trauma informed care is recognizing how trauma shapes individual beliefs, attitudes, and emotions. Nurses must use inclusive language when interacting with survivors and adapt care to meet their needs. Research demonstrates that survivors value patient empowerment, respect, and transparency from their care team. When staff take the time to listen, provide thorough explanations, answer questions, and validate concerns, it builds trust and promotes autonomy. Ensuring continuity of care is incredibly important for survivors. This includes scheduling follow up appointments with a consistent team of providers, coordinating transportation, and connecting survivors with services to minimize barriers to healthcare. Nurses are on the front lines caring for these patients. It's crucial to be attentive, recognize signs, and emphasize autonomy. When a nurse approaches the situation with a lack of knowledge, empathy, or understanding, the patient can feel shame, guilt, or fear. Signs of trafficking can include tattoos displaying connection to trafficking, concurrent or recurrent STIs, multiple sexual partners, fearfulness, inconsistent eye contact, unexplained bruising, or physical trauma. Additionally, the patient may be accompanied by a controlling figure who may have the survivor's possessions and insist on making decisions related to care. Patients may additionally shut down or shorten their answers due to the presence of another person. It's critical to understand how to establish trust with survivors. Healthcare systems should make services accessible by meeting patients where they are. This involves considering mental and emotional readiness as well as physical accessibility. It's vital to ensure that survivors don't feel obligated to share their situation, but feel encouraged to set boundaries that promote safety and well being. Services offered during hospital stays or appointments should feel individualized. This aligns with the understanding that survivors may feel vulnerable and fearful, emphasizing the importance of providing care that is survivor centered and empowering. Supporting survivors and making their boundaries and needs known is a key part of advocacy. Providing trauma informed care overall improves a sense of safety and trust among survivors. It allows them to feel empowered and gain autonomy. Nurses who are competent in providing trauma informed care have a solid understanding that trauma and stress can be experienced by all patients. They are able to reassure and advocate for patients to balance power dynamics between survivors and providers that may act as a barrier for adequate care. With a trusting and engaging foundation with nurses, survivors will feel more inclined to reach out for services. Now that we've come to the end of the presentation, we hope that you will take the post education survey to demonstrate what you've learned about trauma informed care in the healthcare setting. Thank you for your time.